Hey guys, welcome to another dry needling video. So today what we're going to be needling is Andy's hands. More specifically, we're going to go into his thenar eminence, which is the meaty portion of his thumb. There's a group of 4 muscles in his thumb which control most of the movements up, down, in, and out, kind of the circular movements of your thumb. So the reason why Andy's having this tension right now is because he's playing a lot of PlayStation, and so his hand's getting a bit tight. So what we're going to do, we're going to come in here, we're going to needle and see if we can loosen it up today. What we want to do when we're coming in for the thumb, we're going to look for the junction between his first metacarpal and his second metacarpal. The reason why we want to do that is we want to avoid the artery that kind of comes right around that area. So I come up that way, roll my fan over top of that junction. And we're going to come in through the back of his hand rather than through the front because it's more comfortable. On the palm side, you have a lot of the kind of cutaneous nerves, so it'll be very sensitive. I mean, you could do it just won't feel very nice compared to going in through the back side. So again, covering that up, rolling forward. The other thing we want to avoid as well is just any kind of veins that you might see. So no visible veins here on Andy. So what we're going to do, we're going to come this way. We're going to kind of aim it towards the thumb. Okay. Our first pass is just to make sure we go through things that we want, and we already got a twitch there. How'd that feel, Andy?
It's a little bit painful, but it's not too bad.
Yeah, okay. So there we go. It's kind of right through to the very end there. And after that first pass, we can do a few kind of pistons here. Yeah, get a few twitches. Big one right there. Okay. And you can see no blood coming out. So that's a good thing. We'll do another one here. Again, kind of covering up that junction, looking for any veins. You can actually feel kind of the first metacarpal here. And if you come off the bone, slide right off. Aim for those deep muscles in his thumb there. First pass, right through the very end. And then just in that. Twitch. So getting muscles, opponents, flexor pollicis, adductor pollicis, they're all in the same area here. Ooh, we even got one for the index finger there too. Okay. And again, no blood. You can give it a little bit of a massage there, just decrease the sensitivity. Doing alright?
Yep.
Now the other one we can also do, we're going to come off into abductor pollicis. You okay so far?
Mm-hmm.
Yeah. So same thing. You can kind of see that line where the palm transitions, or the palmar tissue or skin transitions into the dorsum of the hand. So if we're trying to get in this way, we don't want to be going in through that palmar skin just because it's more sensitive, so we can always just roll that around like so. Okay. And same dealio, avoid any kind of veins that are visible. So, and it's a smaller muscle, you don't have to go deep. And just right there. Okay. How'd that feel?
Feels good.
Yeah, doing okay?
Yeah.
Give him a thumbs up. It still works.
Feels still good.
Awesome. There you go. Okay, let's give that a rest there. So yeah, that's needling of the thumb. We did a couple spots here. Again, it's very sensitive in the thumb, so we don't want to be doing too many. For Andy here, he's pretty tough, so he's able to get through a few pokes here. But basically all we're trying to do is just loosen up some of the muscles surrounding the thumb that help control kind of that circular movement. So if you use your phone a lot, if you're playing PlayStation a lot like Andy, those muscles will get tight quite often. And yeah, if you guys are enjoying these videos, please subscribe, hit that like button, and hit that bell notification for future videos. I'm going to try to be posting a little bit more this year just because I have a bit more time now. All right, thanks.